Afternoon, good evening, good morning, whichever part of the world you are. My name is Yannick Hicks, and I am truly excited for the guest that we have today for our podcast, which is ACHE of Georgia, American College of Healthcare Executive, our Georgia chapter, Healthcare Leadership Podcast. And ladies and gentlemen, you're in for a treat today. We have Dr. Debi Dalton with us today to share some insight about healthcare leadership that would help to catapult you to the next level as far as your healthcare executive journey is concerned. So, welcome, Dr. Debi, to the podcast.
Well, thank you for having me.
Absolutely. I had the privilege of meeting Dr. Debi Dalton, I think maybe 2 weeks ago or something at one of our American College Healthcare Executive Georgia chapter meeting. And she's very brilliant and ready to extract some of the wisdom and lessons that we can learn today. So, so we're gonna get her started. She was introduced to me by Dr. Catherine Chick, who is the current chair of the board for the Georgia Composite Medical Board. We're having all these intellects and erudites into our podcast, and so he introduced me to Dr. Debi. I got the privilege to talking with her, getting to know more about her journey and experience. But I don't want to go ahead and say that. Dr. Debi, do you mind going ahead and just kind of introduce yourself, and then after that, maybe you can say how you got into medicine.
Sure. Well, thank you. So I'm Debi Dalton. I'm a Chief Medical Officer for Wellstar Paulding Medical Center currently. I served in the same role about 9.5 years at Wellstar Douglas as well. And I am a pediatric emergency physician by training. I am the immediate past president of the Medical Association of Georgia. I'm also past chair of the Composite Medical Board and a fellow of the American College of Healthcare Executives. And I'm a mom of 3 and wife to Sean, who puts up with all my craziness running around town.
Wow, that's incredible. I mean, you just got me. I mean, this we when we talked and I got to know the other. I didn't know you had 3 kids. I mean, how do you get so involved and still at a high level and still be able to balance with 3 kids and family? I mean,
Well, I do have a supportive husband that does help, but my children now are a little bit older, but they went along on the journey with me and very supportive as well. My daughter is 29, my boys are 21 and 19. They're in the process of creating their own lives, which is great, but they were there for most of this journey, only until 10, 11 years or so ago is when I became chief medical officer. So I had my crazy schedule in the ED, holidays, weekends, evenings, overnights, just all over the place. But they kind of rolled with it. That this is the only life they really knew with me being out working. I think they kind of liked that I worked in the ER. Yeah, so they just kind of grew up with it.
They grew up learning how to handle the pressure and intensity.
I hope so. I hope they saw some of that resilience and will use that in their lives as well, I hope.
Wow, that's incredible. Thank you for sharing that. And I'm sure they probably took some of those smarts from you and they're going to go into their various career. Do you mind just kind of sharing with us, how did you begin how you began your medical journey as, to become a doctor or pediatric emergency physician?
Oh, it's a bit of a story, but I will start by telling you that when I was in high school, I really wanted to go into aeronautics. I really wanted to be an astronaut. Of course, I'm going to date myself here, but it was the late 70s that it really piqued my interest. I was a member of the National Space Society at the time. It was called L5, but that's where I wanted to be. But I graduated high school when I was 16, and my parents were not very keen on me going off to aeronautics school. They thought that was not quite the profession for a woman. My aunt was a pharmacist in New York, and we worked for her. And so I kind of cut my teeth on working in the pharmacy a little bit and learn a little bit about the medical profession from that perspective. I started out, just cleaning shelves and stocking shelves and doing that kind of work. But eventually, when I eventually went to pharmacy school and got to learn a lot about running a business and just the science part of pharmacy as well, just from that perspective, just ran with pharmacy, and I thought that's where I was going to be. I was going to land as being a pharmacist, and then at the time, the PharmD program didn't really exist. It was brand new, and there were only 2 colleges I knew of that offered a PharmD program. And then my older brother was the one who talked me into going on. It was a 2-year program, so he told me another extra 2 years I could, finish medical school and be a physician. I kind of feel like I'm a bit of a lifelong learner, and then I like the science part of pharmacy and realize that at the time we didn't have everything done electronically. We had to count the pills, we had to type the label. I kind of felt like I was wasting my science education, so decided to go on to medical school. And then in medical school, I wasn't quite sure what specialty I would end up in, but I kind of leaning towards doing something with procedures. I decided early on that surgery was probably not going to be in my future, but I ended up doing a rotation in pediatrics, and I just kind of fell in love with that, thinking I was going to do maybe infectious disease pediatrics, and then I did a couple of shifts in the emergency department with kids, and fell in love with that, and that's basically how my career rolled into pediatric emergency medicine. I ended up doing residency in pediatrics and a fellowship in pediatric emergency medicine, got board certified in both of those. And then again, I thought that was going to be my life until I moved on to other things as well.
Wow, that is an incredible journey. Of course, we share something similar, going to pharmacy school and becoming a pharmacist. And you decided to advance and leave us on there. I mean, I've also,
Didn't
I've,
leave. I'm always
I've
there.
and always there, of course, it means that you'll be a better physician knowing more about drugs, because in pharmacy school, you learn more drugs than even
Oh yeah.
physician and go deeper into it. Um, Man, that's pretty interesting, fascinating. Yeah, anyone that also decide to get into anything infectious disease, I mean, they're just too clinical. I knew I just couldn't do infectious disease. You just know yourself. It's getting deeper.
It seemed like it was interesting at the time, but I did do elective in infectious disease, but then when I did my rotations in the ED, I just kind of felt that was my home.
Wow, wow, that's incredible. I mean, that's a lot of school to go to pharmacy school, then med school. Uh,
Yeah.
Ladies and gentlemen, you're learning a lot. Like she said, she's a lifelong learner. The message that you need to get from this is be a lifelong learner
Yes,
and always be open to new opportunities. If she didn't have an open mind and just maybe had it, had her mind locked in, then she wouldn't probably be where she is today, explore and maybe be happier. So just have an open mind. You never know where life could take you and I love the fact that you got into pediatric, you loved it, and you got into it, and you just said, well, I'm just gonna stay here. I think those are some of the things that people either will get into pharmacy school or just medicine, and some of the questions and concerns that they have. So
of course.
that's incredible. So now let's shift a little bit. So now you practice emergency medicine and you now move into more executive leadership roles. How did you, what was some of the kind of mindset leadership shift to go from being just maybe a clinician to getting into the executive leadership role in healthcare?
So this was another aspect where I kind of fell into it a little bit and had an open mind still. Uh, when I first moved to Georgia, it was a very small pediatric urgent care. Actually, we were trying to make it into an emergency department, and there was at Cobb Hospital, which was a really small community at the time. When I moved here in 1999, and we were trying to grow it, and we did. But I became the assistant medical director for the emergency department at Cobb Hospital. And so I attended a lot of the medical executive committee meetings. And after being on that for a few years, I was approached and asked if I would be interested in becoming the chief of staff or the president of the medical staff at Cobb Hospital. And I agreed to do it because I already learned the ropes. I had already, was involved in credentials and involved in policy making and all of the other aspects of the med exec team. And I did have some great leaders who guided me. So I did learn from them as well. So that was very helpful. And after that, I was asked by the chief medical officer of that hospital if I was ever interested in doing anything in healthcare administration, I should probably look into getting an MBA or some kind of master's in health administration. And so I looked around and I found an MBA that was all remote, and this was back in 2008. George Washington University offered it virtually, and that was perfect for me because my children were small. My youngest was 2, and so they're all in school. But they did homework with me. We sat together at the table and did homework together, and I would go to do my shifts earlier or stay later so I can complete my assignments. And I was able to complete my MBA in 2 years. And then I was waiting for the opportunity to become CMO, or they were called VP of Medical Affairs at the time. Now they're called CMOs, but an opportunity came up at Douglas Hospital and I made that transition. And I felt it wasn't really leaving clinical. I still continued to do clinical shifts, and I get my little taking care of the kids because I do miss the kids. But it was a nice way of being able to take care of the doctors that work at the hospital as well. So I was hoping my pediatric compassion would extend itself to the adult world as well. And I think that helps my physicians at the hospitals that I work at in terms of trying to stay resilient and strong and enjoy what they do too.
Wow. So she had to take care of 2 kids, right? The kids in the hospital and then the other physicians. No, I'm just kidding. We're just having fun. But that's incredible. I love yeah, Dr. Debi, I love how, people saw leadership potential and ability in you and spoke it, and then you rose to the occasion. Because what I've seen when it comes to leadership, even looking at my journey, I was in pharmacy school in one of the rooms when I was like, well, this is my first time to just go for a leadership position or role. And it was, I said, well, I'll just run for secretary. I'd never been a leader before, never. And this lady said, you should go for president-elect. She saw more in me than I saw in myself. I said, I'm going to run for president-elect. It was for the American Pharmacy Association for our school. And I ran for it. I didn't even have to give a speech, and I became the president-elect and the president. So, as we've been sharing these ideas, speak into people that you see that have leadership potential. Like, I believe, because some people have it, but just need someone to believe in them or cast it for them, or, show them that they can be something, and they'll rise to the occasions. So I love how you just continue to learn and grow. And even at a probably more advanced age, you decided to go to do your MBA. Not a lot of people will still want to be able to advance their career and to learn those ropes and stuff.
It's true. Timing, some of it is timing. And like I mentioned, I did have some good support, and my kids kind of rolled with it too. So I didn't feel so guilty, I suppose, taking time away from them because we did our homework together. It was great. And they kind of enjoyed watching me do homework. I think maybe they thought it was punishment for them, so they kind of liked me being punished. I'm not sure, but we did it all together, and it worked out really, really well.
Wow, that's incredible. So now you're CMO, VP of Medical Affairs, you're leading. What have you seen, or maybe some of the leadership lessons that you've learned for organizations that turn to develop a strong leadership pipeline of leaders and have a strong bench versus those that struggle as far as retention, engagement, workforce, which is some of the, recruitment. Especially those are some of the challenges in healthcare. What are some of the things that you've seen from your own experience?
I think in terms of wanting to develop a leader from my perspective, I look for the same thing I think that people looked for in me.
Mm,
People who are willing to step up and may not have the
mm,
skill set, may not have the ability to speak as well as they think they can. I think some of those things are learned. Uh,
mm.
I think it's just looking for somebody who's interested and willing to participate or step up, and then helping them take that step up and push it forward. I think sometimes there's a little bit of hesitancy, not always. I mean, certainly there are lots of leaders who just kind of jump in and it's all good. But I look for the ones who, the clinicians who are looking to maybe do something a little bit more. And I don't think it's necessarily they want to get out of clinical medicine because they can't stand it anymore. It's too stressful. Yeah, all those day-to-day things that they have to deal with. I really do think that most of the time people are stepping up because they want to make a difference and they want their voice to be heard. They have something to say, they just don't know how to say it. So I do look for that in people, not just at Wellstar, where in the hospital that I work at, but also in Medical Association of Georgia. I watch for that as well, and even at ACHE, there are
Mm,
people who want to be executives, who want to be, move up in that world too. I mean,
mm,
lots of our executives were nurses or physicians or respiratory therapists or pharmacists, and they just
mm.
want to be able to move up into a different role. People like the challenge and don't know how to get to that point. So it's nice to show them that this is doable and you can fit it into your life to make those changes so that you can get where you want to be in the future.
Yeah, one thing that I deduce from what you said is, looking for those who are willing. I think that is, that shows, they're committed. They have the attitude to want to, because if someone is not willing, there's really isn't much that you can do. I love there isn't much that you can do. And I'm in my early leadership years of people reaching out for me to mentor them or develop them. They'll come and say, "Hey, Yannick, I want to do great things, man. If you just mentor me, I'm gonna do this." And then they'll just quit. And then I realized that I need to be looking for people who are willing. I also look for people that have the talent, but I realize that the people that go further are the ones that are more willing to grow and develop than some of the people that are talented. Some of the people that are talented, they just turn to maybe rest on their talent and don't really want to do the work that it takes to be able to get to that level.
I
But
agree with that. I do agree with that. I think if you're willing to, you'll learn the skills you need. You'll learn how to address people the way we need to, and you'll also learn how to build the next generation of leaders as well too, because somebody did it for you. So it's a great way to be able to do that.
really, and I'm sure that that's what you're even doing now, helping the next physicians that are moving up in the healthcare leader, and hopefully they become CMO like you in their organization.
I hope
Yeah,
so.
thanks for sharing. So you worked in, of course, pediatric emergency medicine is always, intense, high pressure. I mean, healthcare is one of the most, high pressure. But not only that, you're actually in the middle. I mean, you work in emergency room, which is
Uh-huh.
always, so if healthcare is already high pressure, then you can just imagine emergency. How did you stay personally grounded and lead effectively during those challenging seasons? And what advice would you give to, leaders who are navigating pressures today?
Well, I think part of it is I found something I really wanted to do and I really loved. Just thinking, not really knowing which specialty I was going to go into, and kind of letting myself be open to finding something I loved. And I just loved taking care of the kids. And then
Mm,
finding the pediatric emergency department. And lots of people tell me, oh, that's so sad. The time is not sad. Most of the time, it's the typical things that kids have. And it's nice to be able to make parents feel better about how they're taking care of their children. But there have been some bad times that we had some unfortunate outcomes for some children, and just being there for the parent and making sure that they have a hand to hold, or somebody to talk to, or somebody to cry to about what's happened. And, you know, so I think that being able to find what you are passionate about, what you love, it definitely helps. And I'd like to say that most physicians and other healthcare professionals have found where they want to be and what they love to do. So that's the first step. Then
Mm,
finding other things that help interject into your life that way. For me, it was important to be a mom. So enjoying my
mm,
children, making time for them helped keep me grounded, especially through COVID and through other, difficult times as well. But just having them to rely on was great for me. But not everybody has children, or they've all
mm,
grown up and gone on their way. But I also found a passion in leadership going through Medical Association of Georgia and ACHE and medical board as well too. And I find that giving back to the
mm,
communities, not necessarily just physician communities, but my other communities, and MAG and the medical board have different perspectives. MAG is much more focused on the physician, so building committees that take care of resilience and other things that are important for physicians, whereas the medical board is more focused on the patients, the people of Georgia, making sure that they're safe. So we look
mm.
through all the health professionals that we license and make sure that they're up to speed. They've got everything that they need. They're following the rules. They know what the rules are. Those things, and make sure that patients are staying safe. It's kind of well rounded for me, and I also volunteer for something called the Bullock Hope House, which is kind of like a Ronald McDonald House, sort of. It's free housing for people who come from out of the area to get medical
Wow.
care in the community. They can't be from the community; they have to be from outside, coming in to get treatment, whether it's the Shepherd Center or Children's Health or Wellstar or Piedmont or any other facility, but they come and get care. So I'd like to be able to give back. So that helps me, knowing that I'm helping other people. Just that makes me happy to be able to help them.
Wow. That is incredible. My mentor, John Maxwell, says success is what happens to you, significance is what happens through you. And you're not just, focused on yourself. You may be incredibly successful, but what you're doing through you, through medical association, through volunteering for the organization, through McDonald's House, some of the other people that you mentor, like I tell leaders, it's like you said, be a river, not a reservoir, right? Pass
So,
on and making a difference. That's how you get more of the fulfillment. And one of the things that I do to stay grounded is my faith. I'm a person of faith, so I serve in my right now I serve in the kids ministry at my church. 5-year-old, 6-year-old.
that's
Um,
great.
it helps me develop some patience because I need I I need someone that patient. I'm gonna switch to the high school because I was like, okay, well, I think I've learned patience enough. I think it's time for me.
You do learn from the kids, but you learn from everybody. Everybody you meet in your life, you'll learn something from them. You just have to be open-minded and just listen. Just listen.
Absolutely, you're right. I've learned more from these kids, and I'm just gonna miss them when I transition to high school. Like I was just there with them yesterday. Incredible experience. It's just so fulfilling when you do something, maybe even outside of your work or outside, or just helping people. It doesn't matter what, in your field, but doing more than just going to your work, doing what it is and living.
Absolutely.
Yeah, you can take care of patients or your work, but that is, something that maybe doesn't require any payment or just no more. Yeah, that would just bring more fulfillment. Well, this has really been incredible conversation. I mean, I wish we could even extend it because I'm loving it. I'm learning, I'm growing, I'm challenged. Like,
Good. I'm
hey,
glad to
I want to
hear
do more. I mean, she's doing all of that. Still have kids. I don't have kids. Then I have no excuse. You shouldn't have any excuse.
that. It's okay. We're all at
You should.
different points in our lives, and we all have different things going on in our lives. It's really about what you find that you're passionate about and what you're willing to give back to everybody else rather than just to yourself. I mean, you learn, and that
Mm,
fulfills you, but you give to everybody else too, and you learn from them.
absolutely, this is great. So as we're even about to wrap it up, do you ever see yourself, I don't know, being an astronaut or even just getting into?
I would love to. I will tell you, I actually did apply to become an astronaut just before COVID hit, and I didn't get to, because COVID. I ended up not finishing up the requirements that they had. They gave you a time limit to complete some requirements. So I didn't do that. So I do have my rejection letter.
What?
At least I tried. And then
Maybe
my next
try.
lifetime, my next
Hey, you get you give me one more shot. All right.
I did.
Maybe somebody else is gonna become the astronaut.
That's okay. I'll watch from
Uh,
afar and admire the people who get to do it.
absolutely. Hey, you've been an incredible physician and leader. I think that's this is your calling. So, final words, these healthcare executive directors, emerging leaders who are coming up in the healthcare, administration leadership. What final words or advice can you give to these leaders? Just looking at your experience in healthcare leadership and administration.
I
Mm,
would say don't be afraid to throw yourself out there. Uh, don't be afraid to say yes. You can always back off. Eventually, you can always back off if you really need to. Things happen in life, and everything can change. But throw yourself out there. Make yourself known. Make people know who you
mm,
are, what you're willing to do. And things kind of fall into place. So you can learn the skills. You'll learn the skills. Those come with time, learning to speak, learning to put together a presentation, learning to get to put together slides. All those things come. And
mm,
don't be afraid to just throw yourself out there and learn from other people. And if you decide, that's not for you, that's okay. You've decided
mm.
because you've actually put yourself out there and figured out that it's probably not where you want to be, and that's all right. Life changes, and uh, you can change with it.
Excellent. So, like she said, don't be afraid to try. Don't get yourself out there. Don't be afraid. What's the worst that can happen? You're still going to be alive. You're not going to die, right?
Fine,
Still
and
going to
you
be
might learn
alive.
something, and or make an impact on somebody else even without even realizing it.
Absolutely. You can still, fail, but still impact somebody else's life and inspire them. So,
True.
go for it. Whatever it is, like she said, go for it. Have an open mind, continually learn, look to make a difference in your field, in your community, just healthcare and just live a significant life. Until then, continue, be a difference maker. Thank you very much.
Thank you too.